certificate of need process for a lot of things. This is sort of a certificate of need process to ensure you don't destabilize your provider network or your community by having providers come in and build something that can't be sustained. We talked a little bit about risk and wrong sizing. We, in addition to our per member per month, receive a certain percentage to do the administrative functions that pay staff salaries, that pay for us to monitor providers. If we were to wrong size the network, we are mandated to monitor their post payments, to monitor them. That takes staff to do. So if the state says this is all we're going to pay you to do that function, because this is how much you should need to serve your members, if you decide to bring 100 more providers into the network, you know, you're going to bear the cost of monitoring and oversight from that, and run the risk they won't have any members at which to see. It also impacts quality of service, and I want to tell you how that occurs. When we had hundreds and hundreds of percent of more providers than we even had capacity needs for, if you need 5 members on a team to break even dollar-wise, and you're vacillating between 4 and 5. Some months you got 4 and you're losing, and some months you got 5. What we began to see is it impacts quality. Because if I'm the supervisor of a team that vacillates right on the edge of barely making it, and I'm supposed to be doing monthly reviews of every member's charts that's getting the service that she's doing, but because times are lean, instead of just being the supervisor for intensive in-home, I'm the supervisor of our residential facility, and I'm the supervisor of a walk-in clinic. And so now, instead of looking at those charts monthly, she's a great therapist. I think I'm going to look at those charts maybe every 3 months. So you start to see quality become impacted when you oversight the network because of economics. The question about how do you become a provider in the network. Credentialing is the process name. It's basically applying to be in the network. The federal government requires us to do certain primary sources verifications, criminal records checks, in all 50 states and every recognized tribal entity in the United States. It involves every sex offender registries check in every state and every border, Canadian, Mexican, and Caribbean countries that may border us. We're required to check the federal exclusionary list, the SAMS database, which is the database for grant eligibility. We have to check the Social Security death database to make sure that you're not assuming the identity of a dead person in order to be in the network. If it's a company applying, anyone that is a 5% more or owner of the company must go through the same criminal records and safety checks. Then, on a monthly basis, we verify your license and your education. Then, on a monthly basis, we re-sweep all those databases with the exception of the criminal records database. But all those databases, licensures, we have to sweep monthly. If you go through those and you're accepted into the network, we can grant you entry for no more than 3 years. And then you go through a re-credentialing process, which is to look at your quality, look at you. Not only are you as a company going through that screening, but any staff member you have working with you that is a licensed staff person in the state of North Carolina goes through all those record checks. Credentialing goes up to sometimes a call of, is someone safe and is the quality there to provide services for our members? And so sometimes you see Cigna who says, yes, I'll let this person do services in our network, and Blue Cross Blue Shield says, we're not going to credential them. And it's the same with our network. We have a credentialing committee which consists of providers in our network, internal staff, and our medical director that reviews cases where there may be a question or determination as to should someone be in the network or not. We also do monitoring. We have a monitoring department totally comprised of staff who work in teams who go out and monitor the providers. These were the list of monitorings that we did last fiscal year. Routine monitoring, there's a cycle so that every 2 years, every provider has a routine monitoring that occurs. We have quality of care concerns, and these are quality of care that may come from care coordination or utilization management where they say, you know, we're a little worried, this care plan came in, we really think that this person needs to be at a higher level of care than the provider is giving them. We need you to go look at that. Or it could be a quality of care, a complaint comes into our complaint network, and it's really about a quality of care and they investigate. We did 102 complaint monitorings. A targeted monitoring is one where we've had 2 or 3 complaints of the same vein. We've done a look, but they continue to come in, and a targeted monitoring is a very deep dive into what's going in with those, and we've conducted 23 of those. We did 90 what's called alternative family living reviews. Alternative family living, sometimes people for children call those therapeutic foster care homes. For adults, they're AFLs. We want to go on site and look at that facility and see if it meets the needs of the individuals that were placed in there. A great example would be a 22-year-old person with intellectual and developmental disabilities. They're in a wheelchair, they've been in their wheelchair their whole life. When my staff goes out to monitor that home, we would expect to see what? A ramp. Because gosh forbid, if something happened in that home, we want that person to get out. What if that 22-year-old is a runner, and every time they get frustrated with either the temperature of their food or the TV shows that are on the TV, they run out the door and they run down the road? Well, if they lived on this main road coming in north of the city here, that could be a problem. If they lived in one of the country roads where traffic's not much, that may not be such a problem. So you look at the individualized needs. Out-of-site reviews. Remember that your network's closed? The network is closed to provider, service, and site. So if I'm a provider in Eastpointe's network and I have an office in Elizabethtown, and I decide I want to open an office in Tarboro, I have to get approval for that expansion because, again, remember the destabilization that occurs. So out-of-site reviews are sites that we need to see expansion in, and we send our staff to monitor to see if that new office site has the confidentiality protections, the safety protections for members are going to see there. We did 492 re-credentialing reviews. Every time we credential or re-credential, we have to do a site visit to that provider to look at where are they storing records, where are they doing supervision. Is this the kind of place that you would want your family member to go in and get services? We reviewed 606 incident report reviews. Providers in our network have an electronic system so that if a level 1, 2, or 3 incident, and we determine those levels in reviews. Previous fiscal year, our provider monitoring and program integrity were in one department. Program integrity investigates waste, fraud, and abuse. And they are the department that links with the State Bureau of Investigation, the Federal Medicaid Fraud Task Force, and the Medicaid Investigatory Unit that's deputized to arrest. And so we did 10 reviews before we separated out and they do their own reviews. We also monitor timeliness of payment, and Sarah talked about $30 million a month roughly goes through for claims. And this I thought you might be interested in. I think from when we met about timeliness of payment. We strive to pay in the first 30 days. That's in our contract after a provider submits their bill. We had 99.61% of all of our claims that we received were paid in that 30-day time frame. We had 0.1% that were the 31 to 30, 17.17% that were in the 60 to 90 day, and then we had 354 claims that were in the 0.1%. So we're really proud of our 99.6% of all claims going in and are paid. We have providers that exit the network. Some of those are voluntary. I'm retiring, or there's not enough business for me to maintain this office. We're consolidating, and they leave voluntarily. We still have some providers that we involuntarily terminate their contract to participate in our network for either performance issues, quality issues, or failure to comply with regulations. We have some that are involuntarily pulled as the federal government or the state government begins their investigatory process. They have the ability to suspend or to cease Medicaid participation, and the federal government has the ability to pull Medicaid because of non-compliance with some of the federal regs. One of the responsibilities for us and our providers is, if you voluntarily or involuntarily terminate your contract, we want to see that the members that you're serving have a smooth transition. So we have a transition team that consists of network folks, care coordination, claims folks, that work so that we ensure that every member makes a safe linkage to where they need to get to a new provider. We also require for records, if you terminate voluntarily or involuntarily all your services in our network, we want to make sure that we have your medical records so that those members can get their medical records as parts of transition for their care. So we do that. We also are responsible for abandoned records, which is becoming more and more of a significant problem as we get a call from landlords who go in to clean out buildings that people didn't pay rent on, or storage units where they go in and find medical records. And so one thing, because of your leadership on the community, if you ever hear that medical records have been abandoned or left behind in those cases, and in their behavioral health, reach out to us. If you don't know what kind of records, let us know. We can go in and get physical help to where they need to get to. I wanted to walk you briefly through our website here. This is the Eastpointe website, www.eastpointe.net. And if you want to ever look at the provider directory, you can certainly do that. And to do that, you scroll down. I'm used to a mouse, so bear with me as I walk here. Okay. Here is, need to search our provider network. Search our provider network. And when you're searching the provider network, there are going to be two areas that are real important. This located in the county and county served. And you're going to hear from some of our providers. Some of them have bricks and mortar here. But I would say most of our services are not delivered at a place. The service comes to you in the community. And in some of our service lines, the IBD service line, I would say they only have one or two services of the maybe 50 different services that you access that you go to a place. All the other services, the staff go to you in your home or your school where you're at. So when you're searching for a provider, it's really important that if you click Bladen County, all you're going to get are bricks and mortars that are here. And you may have a provider that their corporate office is, say, in Charlotte, but they have 25 staff that live in Bladen County that do the service for Bladen County citizens here. So if you're looking for county served, that's where I would encourage you to select from here. Also, if you know that there's a particular provider and you know you want to look for that particular provider, you can click here and let's go to A Small Miracle. If you click here, it brings up the information. This is their address, but it will give you a map to where they're located and clear. And you want to scroll down and you want to serve someone that's familiar with a certain culture or deaf or hard of hearing. You can click there. You can also indicate a specific county, so maybe you're looking for somebody that serves deaf and hard of hearing, Bladen County. I mean, you can.
Can we do that? Can we have an example? I don't mean to interrupt.
No, yeah. You want to do county serve Bladen? Sorry, y'all. It's like, all right, county serve Bladen. Let's go to Bladen. Okay. So we have Bladen. This would give you, just if you stopped here, would give you all the counties, all the individuals that had service site capacity willing to serve Bladen County. Then if you move down and you want to go to a particular, okay, so this is where their bricks and mortar, where their mail goes to. But they serve people in Bladen County because many of these companies have staff or teams embedded within your county. So this is their
Go into
homes, and they work in their homes.
Do you have a provider name on there that is actually in Bladen County?
Yeah, so then what you would do is, if you scroll, here, if we scroll down, a bricks and mortar. Yeah, so let me go back and clear counties served, and if you wanted to look at somebody that was physically located.
How do people know this clear and do that? You just can't click on it and...
The filter?
The filter?
So I thought, okay, so I just want to make sure, because I'm writing this like step stuff down, just so I'll know. I thought that's what we're supposed to go to, is click to county serve, or county service.
Right, but a county served may not be the county where their mailing address is located at. So that's why if you were looking for Bladen County, I would go to county served because that would give.
So just because that's where like a huge miscommunication here is if somebody would like to be able to find a service that's provided in Bladen County, whether it's outside of Bladen County service, they're going to drive to my doorstep and provide me with my services. How do I find it? Like the easiest way?
County served Bladen County. So you would go to county served Bladen County.
And then all of those serve Bladen County.
All they serve residents within Bladen County.
Can you also click on located in Bladen
Yes,
County?
you absolutely can. So let's go back up and let's clear county served from Bladen, and you want to go to located in Bladen. And this you're going to see bricks and mortar here. But again, these are mailing address brick and mortar. And yeah, exactly. So that's why we usually advise folks to do county served.
So how does the general public know that if I need services, I can go to one of those places in Bladen County?
The general public, in terms, that's the Access to Care Call Center. We do a number of promotions through our Community Relations Department. They're out talking with the public, they're talking with school systems, they're talking with the hospitals. I mean, just a number. That just goes back to letting people know who we are and how to access services. So if an individual calls the member call center, which is 24/7, and they say, well, I want to go to, this is what I have going on, and I want to go to Abilities Incorporated. Then our call center staff have access to an electronic calendar that we share with Abilities that have appointment slots available where we can schedule that appointment for the individual. Some individuals says, well, I wanna take the time to get to know some of the providers before I choose one. Then we will walk them through how to access our database online, or we will actually mail them the information as well. So,
And let's go back to, I don't remember who had this, the no wrong door slide.
right,
So, anybody can call that 1-800 number that Victoria went over.
mhm,
But if somebody also knew Abilities is located on highway, whatever that is, I can't see it from here, 298 or 238, or, my eyes need checking. But if they know where that is, they could also drive there and walk in. They will not be turned away. So you can call in anytime, night or day, or you can go to the site if you prefer that and get
Can you
access.
select one brick and mortar provider in Bladen County?
Serve or located?
Located.
Okay, we're talking the same lingo now. So it's located Bladen County. Okay, so you want Carolina's Home Care is here today. So if you were to talk about Carolina's Home Care, you would click, you would see their phone numbers. They've got a website, you can go there. You've got,
Where are they? You say on Swanson Street?
Swanson Street.
I can go there now and get treatment.
well, you can,
Yes.
yeah. They're,
Swanson Street and, we're on Main Street too.
yeah.
They're
So,
gonna work in-
let's finish the
We got
presentation,
two different places there.
because time's running out and we've got people wanting to present.
So, I just wanted to share with you the website. You can do languages. Most people don't access the website. You do see, you mentioned school systems earlier, a lot of them, the social workers, but we say to them, you can call or access, they're there 24/7, 365. They can say, this person's got the appointment, you know, for you to be seen. I wanted to just briefly, because as you said, I know time is short and you've got some folks that are here. You've got Hope for NC. That was last time, and I think you had some follow-up questions that I wanted to go over. Wanted to let you know that this is a pass-through of funding that's going from FEMA to the state of North Carolina through their emergency response. The state then called us and said, hey, these are your local communities impacted. Can we flow this for you to these individuals within the county? So it's a partnership. Alliance is an MCO like us. They have one county, Cumberland, and so they flow the money that goes through to Cumberland County to the providers. They do basically 4 things. They do crisis counseling services. This is not counseling like the network does. This is counseling that's very brief. It's determined. Sometimes when people have been through what your people have been through, they just need somebody to retell the story. They just need to tell the night story again and get hooked up with some resources. They're not mentally ill. They don't need long-term therapy. Now, they're trained, if somebody rises to a certain level, they partner with our mobile crisis team that you'll hear from in a minute, or they'll call our call center and say, you know, this individual is not doing well. We've stopped by in the neighborhood 3 times, and she cries nonstop, you know, and they go to our level. They distribute information about coping or other information about the storms. They do public education presentations, and I know they've reached out to some of you all to get to some of the different civic groups and community groups that you're a part of to speak about it. And they also educate through, you know, some radio talk shows. Say, hey, can you talk on our radio show so folks know you're out there and how to reach them. We have at Eastpointe 2 different teams. We have Team North because so many of our counties were impacted. So Team North covers Edgecombe, Lenore, Sampson, and Wayne counties, and that's Easter Seals. And Team South is Bladen, Columbus, and Robeson, which is RHA. And then Alliance has a team that covers Cumberland County. How long? There are 2 fundings programs. One is the immediate service need funding, that's what they're being funded on now. That typically is about 60 days worth from when the funding comes in till it ends. And then they kick into RSP, which is regular service funding. And I think many of you were aware of the media announcement that state's package request was about $900 million, which included assistance for the farmers, mental health.
Can I interrupt just to ask, how much time do we have, Mr. Pierce?
15 more minutes.
15 more minutes?
We can do that. We have 3 providers here tonight, and I wanted, obviously, we couldn't bring all 259 providers, 62 LIPs, and 44 hospitals. We'd be here for 2 weeks, 3 weeks with no dinner break. But the 3 we brought are gonna highlight 3 of our unique service areas. The first individual is gonna come up, and they're gonna talk about the substance use programs they do for youth in the community through intensive in-home, their outpatient services, and their movement and licensure for some intensive services. Secondly, we'll have a local intellectual and developmental disability provider come and talk about those services and about how mostly they're community-based, and they're located here in Bladen County. And then last is a mental health provider, which most folks don't know about, which is the mobile crisis team, that if it's somebody that we need to assist law enforcement or somebody who's actively suicidal, they deploy for that team. So we're gonna move aside and have them come up, introduce their agencies, and if y'all can limit it to about 5 minutes each.
No, we're not gonna rush through this. We're gonna take what time, and when time runs out, we got a 5:30 meeting, a 6:30 meeting, we'll pick it up at 6:30.
Okay.
And I just want to say a special thank you to our providers. They're not required to attend a meeting like this, but we're excited and very enthusiastic about coming tonight. So I just want to express my personal appreciation to you guys.
So we'll have a substance use one come, and then IDD, and then end up with mobile crisis team.
Good afternoon, how y'all doing? Everybody good? I'm Kelly Williamson, my wife Stacy Williamson from Coastal Southeastern United Care. We're located in Bladenburg. We've been there since 2007. So we're glad to be here. I'll let Stacy talk to you about our services. I'll give you a brochure.
We are located actually on 818 Main Street, South Main Street in Bladenburg. It's the old school building there in Bladenburg. We are actually currently getting ready to start our SAOP and SACOT services, which is substance abuse services. SAOP is a substance abuse intensive outpatient service, which what that means is a 3-day-a-week service with no more than 2 days in between. Clients who suffer from substance abuse disorders, have a diagnosis of substance abuse, and qualify for this service may enter into the program. The first initial thing that they will do is get an assessment completed to make sure that they do actually qualify for the service, and then we put them into service and move forward. The other service that we are getting ready to start up is the SACOT service. It's substance abuse. It's a more comprehensive service, but it's also substance abuse service. It is a 5-day-a-week program, and it's a very intense service. Also, you must qualify for the service by getting an initial assessment completed. In our services located in Bladenboro, we also have a continuum adult service, which means Assertive Community Treatment Team Service. It's called ACT, is the acronym for it. It's sometimes the hospital in Lumberton calls us the hospital on wheels. So we are called so many different things because we have a psychiatrist that's full-time with the service. We go into the homes. We have a voc specialist that's involved, nursing that's involved. So it's a very comprehensive, high-fidelity service that we do, and we service from Bladenboro in Bladen County with that service. A lower level of service with that is CST, which is Community Support Team, which is also adult service up to the age of 18, or 18 and above, sorry. And it's a less intense service, but we still go into the community and do the service with the clients in the home. A lot of our CST clients do suffer from co-occurring disorders, which means substance abuse and mental illness.
And along with the CST, they can get the substance abuse services that we are offering in our Bladenboro office. We also do intensive in-home services with a child service up to the age of 18. So we do have 2 teams in Bladenboro that we are able to service any kids up to the age of 18. This is also an in-home service. We work with the parents, with the children, behavioral issues. We work with the schools, and we're very involved in the community with that service. We also have an outpatient therapist and a doctor who's also located in our Bladenboro office to do psychiatric evaluations as well as comprehensive clinical assessments. And we do outpatient and family therapy, individual therapy, family therapy, a lot of kid and mom therapy. So we do that inside of our Bladenboro office. Do you have any questions? I'm trying to keep it brief and quick for you.
Anyone, any questions for Coastal?
We're very excited and see the big need. We have a lot of clients in Bladenboro who actually walk to our office just to get services. So the clients in Bladenboro, we do see the engagement is very quick. We don't see a lot of no-shows for this area. They actually show up for their appointments. So we try to be conveniently located in that location for the clients to be able, for the availability of the clients.
I got a question. About how many clients do you see on a daily basis?
Well, with our ACT team, we have 120 clients that can be, up to 120 clients that can be served on our ACT team. In Bladenboro, I think we have approximately 30 of those clients. In Bladen County,
on a daily basis, what's your average attendance?
Well, it's a community-based service. So we see each client, so for instance, if we have 30 clients in Bladen County, we will see those clients 3 to 4 times a week. Intensive in-home, up to 3 to 4 times a week. CST, 4 hours a week, up to 4 hours a week, depending on the amount of authorizations that we get and units that we get.
Question on that.
Mr. Cogdell?
How long have you been in Bladenboro?
We've been in Bladenboro since 2009.
2009.
Yes, sir.
The service that I'm asking that you're providing for, I was reading here, opioid addiction, and certain, you say substance abuse. Have you been credentialed to do that in Bladen County? That's what I'm asking. Do you have, I hear you say you're bringing that service online. Is that service already online? Is it being credentialed by Eastpointe?
It is not online. We are in the process of being credentialed, working closely with Eastpointe right now.
So you're in the process of getting
Yes, sir.
licensed to handle substance abuse?
Our facility is actually licensed. We're just opening up the new service.
In this area?
Yes, sir.
It's excellent.
How many patients are you currently serving right now in Bladen County?
Completely, approximately, I would say 75 clients.
And if someone was to call in today or tomorrow, what's the expected wait time?
We have a therapist there 4.5 days a week. And then we try, our initiation engagement is very important to us. We have a quality management team that monitors that. So we try to get the client in within 24 hours, get them seen by our therapist within 24 hours of the actual referral.
What's the latest, I guess, that is going to?
What we've seen over time with our data in-house is 36 hours to 48 hours.
Okay.
One last question. Just one question, just want to make sure I'm clear. When you're in the process
Yes, sir.
of trying to start working with substance abuse,
Yes, sir.
if someone was to walk into your office now and need treatment, what would be the process? What would happen?
And we're currently doing substance abuse.
If you're not, say you're not doing, you're waiting, trying to get ready to do that now, here
Yes,
in
sir.
Bladen County. So if I sent someone to you,
Today.
what would be your answer to that person?
Well, right now we would have to refer out because we would want them to get treatment immediately, of course.
Refer out where to?
To the nearest, probably Whiteville would be the location that I know of that would be closest to here. But as we were talking earlier, end of last week, our services should start ASAP, hopefully.
Mr. Sarah?
I don't users for their outpatient, their psychiatrists see substance abuse.
At this present time?
Yes, sir.
Exactly, they're just adding 2 more services
So I
on.
apologize for not
In the
understanding. In the
Bladenboro.
Bladenboro office, yes, sir.
I wanna make sure.
Clarification,
Yes, ma'am.
you say you do not have inpatient, but where will they go with inpatient service?
That's where we would have to refer out to
Where?
wherever our referral sources would be, which would be, I know there's one in Whiteville,
Only inpatient?
Inpatient would be the hospital.
the substance abuse,
Right.
the intensive outpatient services.
No, she has hospitalization.
Hospitalization.
For substance abuse. Or it can be, service that will house 24/7, that they go, where do we go? Cause I don't know any place nearby that has it. I know someone's in Greenfield or Greensboro,
Right.
not currently, because there was no place for him to go to get service, 24/7, housed.
So it would be a hospitalization, it would be the other outpatient.
Right, it depends on the level of treatment for the individual, because we do have what they call long-term substance use treatment facilities, which is across the state in a sense. So we have to find those facilities who have availability. Then you have your inpatient level, which is your psychiatric hospital inpatient level. You have Southeastern Regional that has a 3rd floor. You have Cherry Hospital, which is in Wayne County, that does psychiatric inpatient treatment as well. So in a case like that, if an individual needs a high level of service like that, our care coordination department will assist the provider in locating
Right.
the treatment facility.
Right.
Okay.
Yes, ma'am.
Yeah.
Do you provide transportation? I mean, I believe you said there's a transportation barrier for some of our clients.
Right, it does, the transportation piece, there's what we call the Medicaid transportation, individuals who have Medicaid. Then there's individuals that have, no funding in terms of state. And so we have, if there's an involuntary commitment situation, then the sheriff would have to transport that individual. And we also, just to add on to that, we also have, some of our counties provide county funding for transportation as well.
Could I ask one question? Are you guys involved when the Department of Correction or either law enforcement be sending people to Black Mountain and into Greenville? Do y'all have anything to do with that? How is that handled?
If it's a member that we serve within our network, then our care coordination department is a part of helping to coordinate that transition. But physically transporting, we do not do that.
So if a person needs some treatment, need to go to Black Mountain, they're on their own.
In terms of the
Get to Black
transportation
Mountain,
piece, no, we'll work to find resources. We're not, right. So
And if they're a
again,
provider client, if they're linked to us, we've transported clients to those facilities before. We don't just, because the family members are usually checked out or, they don't have the support system to do that, so, yeah.
Well, I mean, the situation would be determined where, if he's at the hospital, then the sheriff's department probably has to do it. I mean, it determines on where that mental health patient is.
Anyone may can answer this. You all have grief counselors that visit rest homes?
Typically under Medicaid, just grief therapy, unless it rises to a psychiatric level, is not something we do. Nursing homes and rest homes are deemed to have social worker, clinical staff that are there to do that. But if their level of psychiatric need rises above what they do, then they coordinate with us to find providers for them to see.
Someone would go to the rest home?
Some of our providers go into the nursing home, and some of the nursing homes prefer to transport it. So.
And I've seen nursing homes also, contract out a therapist to come into their nursing homes a lot of times to do that kind of service as well.
We have also available our IDD provider, so
Let me just say one thing on Coastal Southeast. When I was talking to Miss Peggy Hester at West Bladen and Miss Victoria, she give y'all an attaboy for the follow-up on her students, so.
Awesome, thank
Something
you.
positive to come out of this.
Thank you.
So thank you.
Thank you.
Thank you for having us.
Thanks.
Okay.
Will y'all be in contact with us whenever you make your service available?
Absolutely.
Sure.
Absolutely.
I really would appreciate it.
Okay, thank you.
So we need to suspend it till 6:30. Is that a problem?
Let me check with the providers. I told them 5:30 to see if they're able to stay or make arrangements to come
Sorry.
back. Yeah. Is that? Sorry. Is that gonna be an issue? To stay?
Maybe it'll be earlier than 6:30.
We have one that's gotta make arrangements for a daughter.
It's fine, that's what I'm saying,
I'm sorry.
It's not-
No, I'm sorry too, it's a lot of
It's
information.
fine, it's fine.
Okay, we're gonna make it work.
Okay.
We'll make it 6:30.
As soon as we get through this, some tax issues, we can go right back into it.
Okay, awesome.
Where's Renee at?
She's right. I was checking to make sure she had.
So you get ready to go back straight to it right now?
No, no.